Hey, this is Dr. Steve, your mayor. I'm going to bring you a COVID-19 update, and I want to tell you more about what I've been seeing so it'll help you understand what's going on in the local community. We've had this uptick of COVID, and the exposure's not coming from the workplace really, and it's not coming from going in grocery stores and shops. It's really coming from friends and family, and it's just this people crossing groups that they've not socially isolated with before, and they're intermingling, and that's where we're seeing it. So what I would tell you is and particularly if people get sick, even the symptoms that we're seeing now can be this range from very mild, like a sore throat and sinus congestion that just is atypical for you, all the way to the abrupt onset of fever, chills, and muscle aches that would be typical of what we'd think with the flu. And so if you have any of these symptoms, you get them, just immediately quarantine and go home, get tested, so that then we can get your test results and determine if you're contagious or not. The other part that we're seeing is people are getting tested and then they're going right back out to either the workplace, interacting with friends and family, and we're seeing a lot of that spread from people that we already have a high level of concern for. They're out in the workplace or in the community and they're still spreading it. So here's the message. If you're sick, stay home and get tested before you go back out in public. If you have been tested, don't go out in public until you get your results back. And then finally, here's what I'd tell you. We have only a few tools to combat this. This thing about masks, let's don't make it more than what it is. The mask have good evidence-based support to say that it reduces the spread of COVID, and it also protects you as well. And if all of us were wearing masks all the time, then we could really reduce the numbers. And so I still go in stores and I still see people out not wearing your mask. I just say, it's just the right thing to do. Maybe you say, it's not for me, but if it could protect somebody else, particularly somebody who's at risk to really get sick, why not wear it? So I'd really encourage you. There's this, mandatory, we're supposed to be wearing them regularly. If we all do it, we can reduce our numbers. And then the social distancing part's the big thing. That's where we're seeing a lot of the spread, where people are in situations where they can't be more than 6 feet apart. Maybe they're waiting in line for something. Maybe they're in a closed space waiting for a restaurant table to open up. Just make sure you wear your mask and try to social distance. Those are some things that can help us get through this, and we can get through it together, but we all have to work together to do that. Thank you.